The chair will now recognize Ms. Whitten for 5 minutes for your opening statement.
Chairman Guthrie, Ranking Member Eshoo, Chairwoman Rogers, and members of the committee, thank you for the opportunity to testify at today's hearing. My name is Michelle C. Whitten, and I'm the co-founder, president, and CEO of the Global Down Syndrome Foundation and the mother of 2, including Sophia, a vivacious 20-year-old sophomore at Regis University who happens to have Down syndrome. People with Down syndrome are born with 3 copies of chromosome 21 instead of 2. This extra chromosome results in a radically different disease profile whereby people with Down syndrome are highly predisposed to certain diseases and highly protected from others. For example, people with Down syndrome are the largest population with a genetic predisposition to Alzheimer's disease. By studying people with Down syndrome, we can help our loved ones with the condition and potentially help millions of others who suffer from Alzheimer's. Half or more of people with Down syndrome are born with congenital heart defects, are predisposed to autoimmune disorders and to certain blood cancers. Conversely, they are highly protected from developing solid tumor cancers such as breast cancer or prostate cancer. In the 1980s, the average lifespan of a person with Down syndrome was 28, and today it is 60. But that's still 16 years behind the general population. And unfortunately, for those in rural areas and for Black people with Down syndrome, preliminary studies indicate a substantially shorter lifespan. Down syndrome is a complex condition, and research needs that involve almost every one of NIH's 27 institutes and centers. Fortunately, our bipartisan congressional champions, Chair Rogers and Representatives Rosa DeLauro and Tom Cole, recognize the impact Down syndrome research could have on millions of Americans. They increased federal funding and urged NIH to initiate a trans-NIH or NIH-wide effort called INCLUDE, Investigation of Co-occurring Conditions Across the Lifespan to Understand Down Syndrome. Global is forever grateful to these fierce advocates. There's no doubt that the creation of INCLUDE is increasing lifespan and improving health outcomes in those with Down syndrome. Since FY18, INCLUDE has provided 556 unique awards from 18 different NIH institutes and 11 institutes participating in Down syndrome research for the very first time. Just consider some of the progress. Because of INCLUDE, we now have 12 Down syndrome clinical trials, but more is needed. Because of INCLUDE, my daughter and the 450,000 people with Down syndrome in the US are starting to have the opportunity to participate in Alzheimer's research. And INCLUDE has established a groundbreaking data coordinating center led by Dr. Espinosa, where all scientists have open access to research across all the NIH institutes. Global has long advocated for Down syndrome centers, and recently INCLUDE has put out a request for proposal for the very exciting and transformative Down syndrome clinical cohort coordinating centers, DS4C, and centralized biobank. The DeOndra Dixon Include Project Act of 2024 to authorize a trans-NIH model for Down syndrome research would ensure that multiple NIH institutes will collaborate and coordinate research planning, funding, and sharing and disseminating of research results. Global is so moved that our sponsors are paying tribute to our beloved Global Ambassador and Quincy Jones Exceptional Advocacy Awardee DeOndra Dixon, an accomplished self-advocate who tragically passed away in 2020 at the age of 36. This legislation honors her and all individuals with Down syndrome. I also want to express global support for the Charlotte Woodward Organ Transplant Discrimination Prevention Act, which would prohibit healthcare providers and matching entities from discriminating against patients who need organ transplants solely based on disability. This bill highlights the importance of and need for auxiliary aids and services, a support system to assist with postoperative care, and the need for reasonable modifications to policies and procedures to make organ transplant systems and facilities more accessible to those with disabilities. In addition, we want to share our support and appreciation for Chair Rogers' bill, the Protecting Healthcare for All Patients Act, which bans all federal health programs from using discriminatory measures such as the Quality Adjusted Life GEARS to deny or restrict medical coverage for patients with Down syndrome or other conditions. It is important that this applies to all government health programs and not just Medicare. While there is still much work to be done for us to close the gap on lifespan and health outcomes for those with Down syndrome and other intellectual disabilities, the momentum continues to build. For people with Down syndrome, we're entering a new era where they're respected citizens. Authorizing the Include project ensures our dedicated researchers can continue to work to reduce health disparities, elongate life, and improve health outcomes not only for people with Down syndrome, but for everyone. Thank you again for the opportunity to testify today, and I look forward to your questions.